How did a system built to heal become so broken? Why does it feel like we're stuck in old practices in a new age of care? It's time to start asking the tough questions. Because if we don't learn to disrupt healthcare now, it will keep disrupting us. Welcome to Healthcare Disrupted. Welcome. I'm so glad you are all here with us today as we start talking about Healthcare Disrupted. I'm Amy Wilson, and I am the Chief Nurse Executive here at SSM Health. Healthcare Disruptive is really a platform for you, for healthcare clinicians, for leaders, for healthcare operators, for all of those in healthcare who are interested in having a different conversation. A conversation about how we change the status quo and think about a better healthcare system for tomorrow than we have today. So as we start this conversation today, it's really important that we talk about where healthcare has been and where healthcare needs to go. There is a great need across healthcare for strategic disruption. We cannot continue to do things the same old way and expect a different result. So we're here today to talk about how we got here and where we need to go. So let's get started with me telling you all a little bit about me, and it will help you understand kind of where I'm coming from and what my frame of reference is. So I grew up in Alabama, actually in a small town or suburb outside of Birmingham. I am one of those people who always knew that they wanted to be a nurse. I don't know why. I just always felt like I had a calling from a very young age. No one in my family was in healthcare. I didn't know any nurses other than interacting with my pediatrician, and I had a few episodes at the local children's hospital when I was young, but nothing really serious, just normal childhood things. And so I really don't know other than just knowing that sometimes people just have a call for healthcare. And I think that's just who I was and what I was innately supposed to do with my life. And so as I got older, decided that I wanted to go to nursing school. Went to nursing school very young, actually finished nursing school very young. And probably one of the funniest things is that I can remember sitting in nursing school, working through clinicals, being so excited to get out and to practice and thinking, why would anyone ever want to be a leader? That will never be me. I will always be the person who is taking care of patients and families and communities. And lo and behold, I sit here with you all today leading one of the largest healthcare systems in the country with regards to the nursing workforce. So, you never know where your journey is going to take you. There were lots of people along the way for me who were great mentors and friends who guided me and who taught me and who really showed me possibilities and showed me what the impact of change could be. And so through every step in my career, I really had wonderful people surrounding me. And I think one of the things that I'm called to do today, especially in a role as the leader, is to make sure that I'm helping everyone else be the best person they're intended to be and help them see things in themselves that they might not always see themselves. And so I think that's a really important part of who I am as an individual and what my leadership contribution is. So I'm a little bit of a non-traditional chief nurse, meaning that I actually didn't start my career, my leadership career in particular, out in nursing. I actually started in quality and safety. And I'm really proud of that because I think it shaped my view of the world and impacts my view of the world still today. So I actually spent the first part of my career as a leader in quality and safety in an academic medical center. Actually got over into nursing operations and accreditation, went back into quality and safety, and then ultimately ended up in a CNO role over two healthcare systems in Florida. And so after that, really got into operations and then continued to grow within my career to where I was a regional CNO and then in the corporate office at a couple of different facilities and landing here at SSM Health. And so through that journey, not only have I gotten to meet amazing people and be mentored by really wonderful people, I've gotten to see a lot of things. I've been doing this for a really long time. And I think back over the many, many years, and how much things have changed. And I often tell people things are so much harder today than when I started practicing. The world is much more complex. There's a lot that has gone on and changed with the whole digital revolution. And as a result, it's created a lot of complexity in healthcare, complexity that often goes unrecognized and underappreciated. And so this plays out sometimes in our outcomes and the delivery of healthcare, and it also plays out in the way our clinicians are feeling, acting, and behaving as they continue to interact with the healthcare system. So I'm really excited to be able to have conversations with really wonderful clinicians, with operators, with other leaders, technology leaders, really a diverse group of individuals who will all be focused on disrupting healthcare and talk about how do we move forward together in a way that looks different tomorrow than it does today. So our conversation in this podcast isn't just a podcast. It really is a call and a platform for progress that is led by those who live it every single day. And so I think it's important that we lift up the voices of all in healthcare. In order to really have a conversation that maybe we haven't had or haven't always had all the right players together at the table to have this conversation. So we need all healthcare clinicians and operators and innovators at the table discussing innovation and being courageous together to create a better healthcare system for tomorrow. It will take all of us. It will take those of us who live and work and breathe in healthcare every single day to design a better healthcare system. And there is no one better to design it than those of us who are living and working in it every single day. And I have to do a special call out for my nurse friends and colleagues out there. You are one of those professions who doesn't always show up at the table. And so I'm asking you, as we have this conversation, we will include many diverse voices, but a special call out to my nurse colleagues to lean in and start creating. We cannot create the healthcare system of the future without you, the largest portion of our healthcare delivery workforce, highly engaged and highly involved in every single step of the way. You are the most trusted profession in healthcare. And without you, we won't have the voices that we need at the table. I want to share a few stats with you all about the nursing workforce. There are more than 5 million registered nurses in the U.S. About 3.5 million of those are actively working in the field of healthcare today, according to the American Nurses Association and the Bureau of Health Workforce. Nursing has actually been voted the most trusted profession in the U.S. for the 23rd consecutive year in a row by Gallup poll. This is why it's important to all my nursing friends and colleagues that you lean in and show up so that we can have a conversation about how to disrupt healthcare. So as we think about the problem in healthcare, one of the things for us to talk about, and I've mentioned it a couple of times already, is this idea of complexity and how complex our U.S. healthcare system actually is, from our payment models to regulation to how we think about what health actually means in this country. Just the oxymoron between the word healthcare and what we actually do, which is focused on high-end intervention in really acute episodic illness. And so if you pull back for a second, we're actually functioning in a system that is perfectly designed to get the results that we are getting. We have spent a lot of time, money, research, and effort on how do we intervene in really acute illness and save lives. And we're really good at it. We're good at saving lives every day. We're good at helping people who are very sick, intervening with them. And it's even interesting for me to think back over the last 20 plus years that I've been practicing about how far we've come, from pharmacological medicine to interventions to treatment plans to diagnostics. I mean, the technology really has been immense, and it has made significant positive impacts on the lives of many. Unfortunately, we've spent most of our time focusing on intervention instead of prevention. So let's talk about a couple of stats. Healthcare spending in the U.S. increased by 7.5% in 2023 to $4.9 trillion, or $14,570 per capita. Overall, healthcare spending is at an all-time high at 17.6% GDP. This comes from the AMA Center of Health Equity. Then, an estimated 1 in 5 Americans go without health care insurance, or they have inadequate health care insurance. So despite the fact that we're spending all of this money as a country, we still have underinsured across the country who don't have appropriate access to the great health care that they need. In fact, healthcare expenses are the most common cause of bankruptcy in the U.S. in 2007, accounting for almost 62% of U.S. bankruptcies, as compared with 8% in 1981. That is just remarkable how much that has grown and continues to still be the largest cause of bankruptcy in the U.S., according to the American Journal of Medicine. So we are where we are because we have designed a system that focuses on acute care intervention. And again, we're good at it. And our payment models reinforce this, our federal regulation reinforces this, and our utilization trends reinforce this. It doesn't mean it was wrong. It got us to where we are, but it also doesn't mean it's right for the future. We've taught people to only show up to receive health care when they are sick. And that's the social construct in which we are living. And so in order to think about a healthcare system designed to actually think about caring for health in a holistic manner, we have to pull the covers back, think differently, and really start to think about how do we design a system that is focused on prevention as much as it's focused on intervention. So let's talk about the social construct of healthcare a little bit more deeply. So social systems all around us have changed, so it only makes sense that the way we think about health and healthcare has started to change and evolve over the years. We've learned a lot about social determinants of health and how much impact this has on individuals and communities and what their healthcare needs and healthcare outcomes are. We have also learned a lot about different social services and the need to bring together better social services and healthcare in order to really focus on prevention. And there are starting to be some pockets of excellence related to this across the U.S., but we've really failed to think about how do we scale this? How do we think about this at scale to really become transformational? And one of those complexities that holds us back in this space is really thinking about payment and payment reform. And so how do we start thinking about being reimbursed and paying for prevention in order to prevent all of those acute episodic illness, or keep people more at a maintenance level of health where they can be cared for in their homes and in their communities? I don't know about you all, but I'd much rather, when I'm not feeling well or I'm sick or wanting to take care of myself, I'll always rather be at home than be in a hospital or a clinic somewhere, being close to my family and my friends and my loved ones. And I think for most people, maybe not for all, but for most, that's where they'd rather be. And so how do we start thinking about care being delivered to where people are, meeting people where they are and what they need in the moment, and starting to understand what their goals of care may be, as opposed to what my goal as a clinician may be. So all of these learnings have given us the opportunity as a country to really experiment with the concept of value-based care. And there's a huge calling and cry across the country today for the move to value. And this will be really important as we think about transforming healthcare. So how do we focus on population health? How do we focus on keeping folks healthy? How do we focus on more care in the home and less care in our acute care facilities? And so all of us who grew up in acute care will have to learn that the world does not center around us. And so in learning that, we will also have to learn to start thinking differently about care delivery models. And we can't continue to deliver care in the same old manner that we've always delivered care in. And so we are going to also have to disrupt those care delivery models as we think about our move to value and how we provide even better care closer to home, where individuals are living and socializing and working in order to keep them there more often and keep them out of our acute care facilities. So we've talked a lot about the complexity in healthcare. So let's talk a little bit now about the hard truths and looking ahead to the future. One of the hard truths is really the impact that the current healthcare situation has had on all of our clinicians. And so as a clinician, it is like walking back in time 20 years when you walk into some of our care delivery sites. And the reason for that really is that as the digital world has evolved around us, we really haven't kept up in healthcare. And we've not kept up for good reason. There's a lot of regulation. There's a lot of payment models that impact that. And quite frankly, we're dealing with really personal protected health information. And we are really sensitive to that and want to be thoughtful about being the custodians of that. And so we've been really reluctant to move forward around thinking differently. There's not been a lot of disruption in the technology space related to this. And so we really do need that disruption. And sometimes when I think about clinicians and the burnout that they're experiencing, I truly believe it's because of really feeling like you're walking back in time every time you go into work, meaning that no longer does your smartphone work to answer all the questions that you have. No longer are you able to do things in one click. It takes a million clicks, it feels like sometimes, to get through to all the different places that you need in your electronic healthcare record, to be able to process the abundance of information that we now have on patients and families that we would have never had before because it wasn't related to the reason that they were seeing us or their chief complaint. And so it really has created this burden for our clinicians where they're trying to balance all of this. So let's talk about a couple of stats that are really impacting the workforce that we need to be thoughtful of. You often hear about the nursing shortage. And according to the 2020 HRSA Nursing Workforce Projections Report, nationally, there is a projected shortage of 78,610 FTEs or full-time equivalent RNs in 2025. And in 2030, we expect there to be about 63,720 nurses working full-time that we are short. So this means that when you think about this from a supply and demand perspective, that we're predicting a 98% of the total demand for nurses will be met, leaving 2% not met, which is pretty significant. COVID-19, as you all know, really caused significant burnout. 35% of our nurses wanted to leave the bedside in 2022. And so we might see this shortage grow even more profound than what it's predicting today. A 2020 National Nursing Workforce Survey found that the average age of an RN is 52 years old. This means that nurses are about to be retiring in masses, and there won't be enough new nurses to replace them. This issue is so concerning that the ANA, the American Nurses Association, sent a letter to the U.S. Department of Health and Human Services in September of 2021 urging the country to declare a current and unsustainable nurse staffing shortage to be a national crisis. But it's not just nurses that we're experiencing this shortage in. We actually don't have enough physicians either. And the projected shortage of physicians is somewhere around 87,150 primary care physicians by 2037. So here we are talking about pulling healthcare upstream and thinking about health and the need for prevention instead of only intervention. But we're also predicting a significant shortfall in our primary healthcare physicians, which play an important role in prevention. And then I want you to think about our pharmacists. The American Association of Colleges of Pharmacy showed a 35% drop in applicants from 2011 to 2022. This is a deficit of 2,000 pharmacists annually, with the need for pharmacists actually projected to grow by 5% in 2033. And so this is really an opportunity for us. We can always think about the glass half full or the glass half empty. And I'm more of a half full kind of gal. And so this is the opportunity for us to think about disruption. We need all of these clinicians plus more disrupting healthcare. And another reason, other than simply our patients, families, and our communities, if that wasn't enough to think about healthcare disruption, is really about our clinical workforce and our operational workforce. If we're going to have a workforce that's sustainable for the future, a workforce where people feel called and led to go into healthcare, we're going to have to create a situation where they can do what they intend to do every single day, which is show up and give really excellent patient-centered care. And unfortunately, because of the complexity that we're living and working in every single day, there are many clinicians out there, many doctors, nurses, pharmacists, radiology technicians, et cetera, who don't feel like at the end of the day that they gave really good care and that they made a difference. And so we need to figure out a way to not only help our clinicians feel like they gave really good care and made a difference, but be able to demonstrate that in our outcomes, that we are giving good care in a patient-centered, patient-centric way. So I actually think we have a framework to be able to solve some of these complex problems. Most of you will have heard of the quadruple aim. And in literature, it's now being referred to as the quintuplet aim as we add decreasing or eliminating healthcare disparities. So if we just think through the quintuplet aim for a second, we need to improve the patient experience, and we need to see experience through their eyes, not the eyes of a clinician. We have to improve population health, meaning taking care of populations and communities and improving the health and the outcomes for those populations. We must reduce the overall healthcare cost. We've talked a lot about the cost to the country, to the healthcare delivery system, and to the individual. And the current cost is not sustainable for any of those three. We must advance health equity. We cannot afford to continue to have different populations of individuals with the same disease process having different outcomes. And overall, we must figure out how to do this, all while improving our clinician well-being. If we don't improve our clinician well-being at the same time that we're doing all of this, we will end up with an unsustainable clinical workforce. And an unsustainable clinical workforce does not help us disrupt the U.S. healthcare system. What's next? We will lift up the voice of all those that matter within healthcare. We will address these topics and more in an upcoming episodes of Healthcare Disrupted. Everything from the micro issues to the big macro issues that we are dealing with. We will talk about how we can think, act, and behave differently as we learn to iterate and to disrupt and to ultimately design a better healthcare delivery system focused both on value and actual health. We will hear from all different stakeholders, and we're going to give every single person a seat at the table to bring forth solutions. We will talk about the complexity, we'll readdress it, we'll take a deep dive into this complexity, and we'll think about how all of these things work together or should work together to disrupt healthcare. I'll leave you with this. It's really about the butterfly effect. How do we start to create enough ripples that we have emergence and ultimately transformation? Thank you for spending time with us today. I'm looking forward to us continuing the conversation. Thank you so much for joining me on this episode of Healthcare Disrupted. We want to hear your voice, so dive into the conversation with us, challenge us, and help us disrupt healthcare for the better. Like this episode, subscribe now, and wherever you get your podcast, follow us on this journey.